Hello everyone. Today I'm going to be talking about the effects diabetes has on the oral cavity. What is diabetes? Diabetes is a disease in which the body does not produce or properly use insulin. Insulin is a hormone needed to convert sugars, starches, and other food into energy. In 2012, 9.3% of the population had diabetes. Common symptoms are being thirsty, weight loss, tingling, pain in hands and feet. Type 1 diabetes is commonly diagnosed in children and young adults. Approximately 1.25 million American children and adults have type 1 diabetes. It is usually caused by genetics. They are insulin dependent and are required to take insulin to manage blood sugar levels. They suffer from weight loss, fatigue, and frequent urination. Type 2 diabetes is the most common form of diabetes. They are insulin resistant. Type 2 diabetics are generally overweight or obese. They suffer from blurred vision. Type 2 diabetes is managed by a change in diet and medication, sometimes by insulin therapy. So how does diabetes affect your oral health? Diabetes has been associated with periodontal disease. Patients with severe periodontitis have a harder time controlling non-insulin dependent diabetes. They are 3 times more likely to have attachment and bone loss with diabetes. They can also have dry mouth. With type 2 diabetes and the medication they take, they suffer from red, swollen, and painful gingiva. They can lower the resistance of the tissue and the infection. How does diabetes affect oral health? Continued. Persons with diabetes is at risk for thrush, which is an infection caused by fungus that grows in the mouth. It can complicate oral surgery, it slows healing, and increases the infection. People with diabetes also suffer from burning mouth syndrome. So here are some ways to prevent oral health complications. Keep your diabetes under control. Whether you're type 1 or type 2, make sure you keep your blood glucose levels in the right zone. Make sure that you are taking your insulin when directed. Using a water pick for oral hygiene routine can also help gum tissue in patients with diabetes. Be sure to visit the dentist every 6 months for your checkup and your cleaning. And be sure to let them know of any health changes or any changes in your medication. Avoid your smoking and other tobacco. Also, if you have dentures, make sure to remove and clean them daily if applicable. And there's my resource page. Thank you guys.